CBS 46 News presents Public Affairs on Peach.
Good morning and welcome to Public Affairs on Peach. I'm Karen Greer. Over the next half hour, we're going to talk about autism from all kinds of different perspectives. But in order to set the groundwork, we're going to start with the medical overview. And my first guest is Dr. Cheryl Clayman from the Marcus Autism Center. Thank you so much for joining us, Dr. Clayman.
Thank you for having me.
Let's start with some of the most basic questions out here, and that is, what is autism and how is it caused?
That's a great question. So autism is what we consider a neurodevelopmental disorder. And what we mean by that is it's a disorder that unfolds over the first few years of a child's life, and it affects all areas or lots of areas of a child's development. And autism is a social disability. So we think of it as the core social disability is what autism is affecting the most. What causes it? We're still kind of trying to figure that out. So it's a complex disorder. There's many genes involved. About 50% of the risk is because of genetics. The 50% is other stuff that we're still also trying to learn.
So we're knocking out the whole notion that people have said it's vaccines that cause autism right now.
Absolutely. It is not vaccines. We know that for a fact. There's been millions and millions of dollars poured in. And the problem with it is if you don't vaccinate your child, they're at risk for much more dangerous diseases that were eradicated.
A lot of people have heard of Asperger's syndrome. What is the difference between Asperger's and autism?
That's also a great question. So Asperger's syndrome was a disorder that we used to call for kids that had better cognitive functioning or higher cognitive functioning and tended to be really verbal and have what we call perseverative interests, so things that they were really kind of fixated on. In the latest edition of the diagnostic manual, Asperger's syndrome is not in there anymore. We refer to it as a term of autism spectrum disorder, and everything's kind of folding up the same now.
You brought up a very important question right there. We do hear about the autism spectrum, so what's included in that?
So the autism spectrum is the label that we use to characterize the whole group of children that meet criteria for an autism spectrum disorder. And the thing about autism is that it's a really complex disorder and everybody presents pretty differently. So we have a saying in the field that if you have met one child with autism, you've met one child with autism. And because of the complexity of it, the spectrum is trying to capture all of that. So we have kids that are very cognitively able, we have kids that have more intellectual disabilities, we have kids that are very verbal, we have kids that are nonverbal, and the spectrum is capturing that whole range of disability.
I thought was interesting in researching this, Cheryl, is that it's more likely for autism to affect boys than girls. Do we have any idea why that is?
Sure. So right now the statistics are that about 4 times as many boys have autism spectrum disorder than girls. And the reasons for that are kind of difficult to also understand, but one of the things that we know is that yes, it's probably true that there is some increased prevalence in boys, but girls have also not been quite as well studied. And our diagnostic criteria that we've used to define what autism is has been based on research in boys. So we've got a lot of work to do to make sure that we're not missing those girls that have social difficulties or have an autism spectrum disorder and that they don't slip between the cracks.
Well, that's very good. Now, for parents at home that are watching, what are some of the signs, the symptoms, things they should be looking out for to call a doctor and perhaps get some help?
Sure. So if you have any concerns that your child might have an autism spectrum disorder or is not developing and meeting their developmental milestones, so the CDC puts out great developmental milestones, you should be contacting and speaking with your pediatrician. The things that we're looking for in autism do change over the course of development, but if your child is not engaging with their peers the way you would expect them to be, if they're not learning to speak, if they're not making great eye contact, if they're engaging in some atypical behaviors such as walking around and ignoring other people, flapping their hands, things like that, those are things that you want to be on the lookout for. And bring it up with your pediatrician to make sure that you're getting into interventions as early as possible.
Now, once a child is actually diagnosed on the autism spectrum, what are those interventions? What kinds of things?
Sure, and there's a whole range of them, and it can be overwhelming for a parent, so we really encourage you to speak to the providers that have worked with you and your child to make sure that you're, understanding that literature. But the treatment options are a lot, and it kind of depends on the age of the child as well, but we want to make sure that a child is getting empirically validated treatments, so ones that we know that are effective for treating kids with autism. There's a lot of behavioral therapies, speech and language therapy, occupational therapies, it runs the gamut.
I'm telling how long I've been here now because I remember when the Marcus Autism Center even opened. Talk a little bit about, and we've got like 30 seconds, Give them a web address if people want to learn more
Sure.
about autism.
So the Marcus Autism Center is one of the largest treatment and diagnostic facilities in the United States. We see about 5,500 kids with autism just within our doors every year, and a whole host more outside. To learn more about the Marcus Autism Center, you can visit www.marcus.org.
Wonderful. Cheryl, thank you so much.
Oh, my pleasure. Thank you.
And when Public Affairs on Peach returns, the Autism Viewpoint from two parents who've actually lived it. We'll be right back.